Good evening, Mr. Chairman, Mr. Vice Chairman, members of the committee. My name is Cameron Duncan. I'm the Associate General Counsel of the Texas Hospital Association, and I am here to testify in support of, on behalf of the Texas Hospital Association of HB 2241. I'm going to divert from my prepared remarks a little bit because, one, I think Chairman Alberson, you laid out the bill really well with a lot of clarity, better than I could have explained it for sure. But I want to start with, very clearly, HB 2241 does not change the law. I mean, just right from the outset. I'm going to read you a bullet point from the former commissioner of the Texas Department of Insurance, just sent January 7th of last year to all the health plans in Texas who all received this. It says, claim denials based on a failure to meet the prudent layperson standard for emergency care must be based on a review of the patient's presenting symptoms, not the later diagnosis code. So explain to me how this helps a freestanding ER, how this changes anything. This freestanding ER argument is the biggest red herring that you've ever seen in your life. It's shameful. I'm ashamed, and I fail to understand how AARP, whose membership is represented by Medicare, eligible population, have any stake in this bill which doesn't touch Medicare or change anything else. You know, if you're a hospital or a provider and you want to look and you want to argue about a claim, you know, it's not very helpful to point to, you know, simply, oh, this letter from the insurance commissioners out there. We're just trying to put something in a statute that somebody could point to. Now, is this going to fix everything? Absolutely not. The prudent layperson standard is still there. Is a $10,000 COVID test going to meet the prudent layperson standard? Absolutely not. Would any one of you think it's appropriate to pay $10,000 for a COVID test and that is an emergency? That's what the prudent layperson standard is. It's that simple. And inserting the word solely, as Ms. Dudensing proposed, would actually completely unwind the bill and for the first time allow diagnosis to be a factor in the prudent layperson standard. And then my understanding on the utilization review language is that language actually came from the Texas Department of Insurance as a clarification. So those are my beginning parts. And I want to touch on a few other things. Going back to how this doesn't change the law, the 11th Circuit Court of Appeals, which is Georgia, Florida, Alabama, just issued a ruling that affirmed this same interpretation of the law. 7 other states, red and blue states, have passed similar legislation. Colorado, Maine, Michigan, Missouri, New Jersey, North Carolina, and Virginia. And these policies that undermine the prudent layperson standard and base it on diagnosis are dangerous for patients. They dissuade patients from going to the emergency room. That's what they're designed to do. And I know my time is up. I have a few examples of the recent implementation of some policies that were actually downcoded from emergency all the way down to an $85 triage fee, if you'll indulge me. So these are all from one hospital in 1 month. So in actually less than a 30-day period.
Just give us one example.
One example. Yeah. So on a Sunday at 4:16 p.m., a 27-year-old pregnant female with a laceration in the face received stitches, a 1 centimeter width laceration. That was coded as a level 4 emergency visit and then downcoded to an $85 triage fee. So these are real life examples and they're very problematic, and I'm happy to take any questions from the committee.
Questions, members? Thank you, sir.
Thank you. I appreciate the opportunity to testify today.
Chair calls Dr. Deanna Fight.